You see that people are about 40 times more likely to rate their mental health as being poor if they're lonely. And so you also see that people are less satisfied with their life and less happy. And so I think like if we can address that through social connection, maybe it'll give us a bit of the inspiration that we need to connect with others in ways that could address some of those bigger issues, through community organizing and activism, getting people engaged to address and figure out how do we make our workplaces more healthier. People need energy to change the system. And when you're constantly running on fumes, right, it really makes it difficult to put the energy into the sort of activism and social entrepreneurship that is needed to make our world a more pro-human place to live.
Hello, everybody. Welcome to Different Boat, Same Storm, a video podcast that is aimed at kindling empathy amidst the global pandemic.
We're so excited to have a new guest this week. Our guest today is Dr. Kiffer G. Kiffer is a great person. He's really great to talk to, and he's a researcher. He researches social isolation, loneliness, connectedness, and so many other topics that are so critical during this pandemic. We're really grateful to have Kiffer on the show today. Dr. Card, or Kiffer, I should say. How are you doing today?
I'm great. Good to be here with you both.
Awesome. Kiffer, if you were to introduce yourself, how would you describe yourself for our audience today?
Yeah, well, I'm just a normal person. I do research, as you said. I guess I could identify as a researcher. And as you mentioned, my research really focuses on social connection, on human connection, and things that I feel are just important. And so, throughout my academic career and training, I've researched a variety of topics, usually focusing on those things that I find most pressing for our culture and society, ranging from, sexuality, substance use and addiction, social connection and health, and how all those things kind of come together to impact who we are and the sort of lives we lead. And so I'm a postdoctoral fellow and research fellow at the School of Public Health and Social Policy at the University of Victoria, and an adjunct professor at Simon Fraser University. And so I do a bit of mix of teaching and research, predominantly right now throughout the pandemic, focusing more on research and particularly research related to our social health and wellness.
Well, that's quite a lot, and I'm sure that it must be keeping you busy. I feel like if there's any time to study social isolation and loneliness and the impacts on that on our mental and emotional health, it's a global pandemic. So I'm curious as to what that experience has been like for you to not just study these things, I wouldn't say in an abstract sense, because they were still very real even before the pandemic, but so accentuated and in your face almost.
Yeah, I mean, I first started researching social connection at the beginning of my PhD. And at the time, I actually kind of felt like I kind of began to feel like my dissertation was kind of irrelevant, because it wasn't something focused on. But I was really interested in how our social connections were fundamentally changing as a result of the introduction of apps and websites, internet-mediated communication, and how that was affecting how we think and behave and what we believe and how we relate to one another and connect. And so that's really what got my work started in this area. And then, with the Canadian opiate epidemic, I started to move into substance use. But when COVID pandemic hit, people were all of a sudden afraid to connect socially. I had some background in epidemiology as a trained epidemiologist working in HIV and sexually transmitted infections. And communities that I was working with or that I was familiar with started to ask for guidance and help on how we can connect. And so I kind of got roped back into the work I was doing around social connection as a result of the pandemic. In realizing just how profound an effect the pandemic was having on people, and knowing some of the consequences about the long-term health effects that, if you're lonely, you're between 30 and 50% more likely to have early death. And so, that's equivalent to things like obesity and sedentary living. But nobody really teaches people about the importance of social connection. We typically think of, diet and exercise as being what's really important. But in fact, it's that human connection that is really important to regulating stress, to keeping yourself active, to keeping yourself have the sort of social support that you need to make other health decisions in your life. And so, so that work really came to the forefront in the midst of the pandemic. And so we've been working to kind of launch and raise awareness, working with a national partner called the Genwell Project, who's been working for the past 6 years to try to raise awareness around this. And COVID has really just opened people's eyes to the reality that is loneliness and social isolation. All of us experience it a little bit at some point in our life, but now we kind of are all sharing in it together of what it's like to be alone and separated from others. And so, it's been an interesting opportunity to connect on this way and to leverage my epidemiological training to help people better understand the importance of human connection. Absolutely.
And Kiffer, you mentioned that even before the pandemic, the landscape was kind of shifting in terms of how we connect with each other. Probably before I was born and Harv was born, connections were totally different. You weren't connecting with people over a Zoom call, let alone like a phone call as much, or texts and apps. Like you mentioned that apps have changed how we do connect. How exactly has that been the case even before the pandemic?
Yeah, so there's been a lot of debate and discussion over particularly the role of social media in terms of how it changes how we interact with one another. And it's difficult to say exactly how it's working out to affect people. We know, for example, that people who are lonely or socially isolated, they actually will prefer social media as a mode of connection because it requires less commitment, because it requires less social threat, right? You're not as much putting yourself out there. You can behave anonymously. You can, connect in ways that are more comfortable for you. And so it's not just that social media is making us more disconnected, but actually provides an outlet and an important way for some people to connect. And so I think everybody has different relationships with these apps and websites and how they use them. And I think now in the research and in the literature, we're starting to get a bit past the question of, does social media and do these apps cause us to be more disconnected, and more about how can we utilize these better to improve our relationships. And so when we're using social media to connect, like you're using it to really find sincere ways to connect and build each other up and build relationships, then social media, is probably going to have great effects. But when we use social media in kind of destructive or antisocial or counterproductive ways, then that's further alienating people. And so I think everybody's experience is going to be a little bit different in terms of what role social media, what role apps have in our lives. There is some research to support kind of the idea that the more real an encounter is, so the more in-person, so we would say that like an in-person connection would be of greater benefit to you than a video connection. A video connection would probably be better than a phone call. A phone call would probably be better than a text, and kind of down the line. That the more real it is to you, or the more rich the media is, then the potential benefits are greater for social connection. And so certainly those sorts of patterns have changed, but I don't think it's a necessity so much as that we can leverage these tools to build connections in really great ways. And you see people doing that in every community, people leveraging, different apps out there to find ways to connect with others. And so I think that's a really interesting piece of the technology issue, is like figuring out, how can we make it a better tool that actually improves our lives rather than degrades it.
Right. I think more often than not, we tend to not look at the positives or the potential and opportunities with these new modes of communication, and just resort to bashing them and dismissing them. And understandably, they're not meant to be substitutes, they're meant to be complements. And I think that's something that we often forget, that there's nothing that's going to replace physical human connection, but the tools that we have at our disposal, they can help enhance that experience. They can help mitigate hindrances and obstacles that some people might face to eventually engage in those kinds of experiences. And they can make the experiences more accessible, but they're not the solution itself. They're a means to get to that physical, human, real connection.
Yeah, I think that's a really important piece, is that if you think about it, some people take like an evolutionary perspective and they think about the tens of thousands of years that we've evolved. Really, it's just this flash in the pan that we've had these sort of technologies. And so the way your body is designed to respond to other human beings, smell, sight, touch, like all those really important things about physical and in-person connection, those are still very much there and needs. And so, there's lots of research, around like children and their parents and the importance of hugging and kissing and all those important, intimacies that we share with families and friends and loved ones, of how important that is for regulating stress. And so I think in the midst of the pandemic, now in which we find that, 6 in 10 Canadians are feeling lonelier, we find that it's actually a really profound influence, not having those, because that means all the benefits of those connections that we might normally enjoy. If you're living alone, or you're living in a senior care home, or if you're living out on the streets, you're missing those opportunities for that sort of social connection, the stress reduction. And that has real health consequences. And that means everything you're doing, going to the store, going to work, doing simple tasks, all of it's just a little bit more stressful. And that has a cumulative effect. And I think that's why so many people are experiencing, burnout. We ran a survey recently called the Canadian Social Connection Survey, and we asked about burnout. And we found that approximately 1/3 of Canadians are kind of meeting that clinical diagnosis criteria. It's not like in the DSM, but of the scale cutoffs for being burnt out. And 66%, or about 2/3, they are experiencing signs and symptoms of burnout. And I think a lot of that has to do with the fact that people don't have the same levels of social support that they once had before the pandemic. And so I think that's really, at the center of a lot of what it means to connect with others is, the benefits that it has for you.
Yeah, I mean, some of those statistics are just striking. And so you sent Atharv and I a survey beforehand, and some of the statistics that popped up to us, like 95% of people who have poor self-rated mental health are lonely. 4 in 10 Canadians want to have more friends. So that's 40% of Canadians. And 1 in 4 Canadians who are lonely experienced loneliness prior to COVID-19. So again, this is not necessarily a new phenomena of loneliness, but we're seeing it amplified now at a level that we've kind of never seen before. I wonder, Kiffer, we're looking at public health, and we've had conversations about public health on this podcast. But like you mentioned, there's not often a focus on social connection as an indicator of health. We look at diabetes, we look at physical activity, we look at like certain diseases, and during COVID, infectious disease. Even bigger things like climate change are less often linked to public health at large. And of course, we're seeing changes now, but looking at social connection, why do you think it is that we don't see it as a big public health problem, and what do we do about that?
Yeah, I mean, public health is this really interesting field, right? It's kind of a blend of medicine, social sciences, those sort of things. But a lot of academia, at least in my opinion, is often focused on responding. It's reactive. It's looking at, there's a crisis, let's deal with the crisis. And let's document it. Even epidemiology, which is my training, epidemiology is about documenting the distributions and determinants of disease. And while I think we give a lot of kind of a lot of lip service to the idea of prevention, to addressing what we call upstream determinants. And so, we think of like cancer or, cardiovascular disease or obesity. All of these things are public health concerns, certainly. And we might say, okay, the next immediate thing is diet and exercise is what we should. And so a lot of public health policy and a lot of public health practice gets stuck at diet and exercise, but it doesn't look upstream to those upstream determinants. Even though we talk about how important they are, the social determinants of health, it doesn't seem that our public health systems are really mobilized to address those. And so I think this creates a lot of problems in public health and medicine, in that all of our resources and energies go into treating disease rather than preventing it. And I think Social health is one of those things that it's upstream, right? There are certainly problems that arises from unhealthy social situations that have immediate and direct consequences for individuals. Things like spousal abuse, child abuse, those sorts of things can have a really profound effect that if you don't have that social support network in place, then the consequences can be acute. They can happen. They can, cause injury, death, whatever. But for the most part, when we think of social health is so far upstream that we don't often recognize that like cumulative stress effect that being disconnected has on a person, that degrades heart health. It causes immune functions to more properly. It depletes energy reserves, which means your body is processing things less efficiently, which opens the doors for things like cancer and cardiovascular disease. If you're not it opens the door to things like depression and mental health issues, which cause you to not exercise, right? So you can see that really these things are all connected in kind of a web. But public health has like its kind of traditional medicalized model of addressing issues. And unfortunately, it's been a real challenge for public health to figure out how we get beyond those immediate health effects. And I think some of that is hopefully changing with COVID. I think during COVID, people have started to think a bit more about preventing things, rather than just kind of chasing our tails to treat them.
The focus is more so on putting out fires that are already blazing, rather than preventing the fires from erupting in the first place. And also, health is also a social issue rather than just being a biomedical issue. And that's something that's not left. And that speaks to a larger question, larger concern of how aspects of health, which are not necessarily seen in a very physical sense, are disregarded and are not prioritized, both at an individual level, but also at a larger policy level, which goes to show the priorities of those that have power to enact change.
Yeah, I think that's an interesting statement, just the power to enact change. Is a lot of our problems also come from those fundamental inequities, right, in who has power. And so in today's society, right, there's certain class and gender and all those things come into play in shaping who has social power. And I think that that shapes some of the objectives and aims of what public health seeks to do, right? It's not that health problems tend to affect differently based on socioeconomic status or gender. Some of that is biological, but like you said, the bulk of it is not. It's social. And so I think that's a really critical issue that, again, makes it a little bit more hard to respond to social health as like a legitimate bona fide health issue. I'm hoping that COVID-19 is starting to wake people up to the reality that social health really is critical. Many Canadians are seeing children developing in a context of COVID-19, and that has impacts for what those children will ultimately go on to, how those relationships will form throughout their whole lives based on what they're doing now. I think that Stats Canada, released a statistic that something like 2/3 of parents were worried and concerned about their children's health. And so, I'm hopeful and optimistic that we are moving towards a more holistic definition of health that includes social connections and community wellness and neighborhood cohesion as valuable aims and objectives for municipal and provincial governments to pursue in the name of public health and happiness and satisfaction.
Yeah, I mean, Kiffer, you mentioned, and Atharv, you build on this, that it is institutions that create these problems that we see. It's not that like certain people are just automatically going to experience the worst impacts of a certain issue. And of course, there's the biological piece, but most of what we see, especially in COVID, is that institutional and systemic piece. And that's where discrimination and racism, like we see that firsthand, and we can link it back to those root causes. Kiffer, you're here in BC during this historic heat wave that's taking over the entire west coast of the United States, BC, Alberta, I think even up to the Yukon. We look at this sort of issue and we see that 60 people, or I think 70 people have died over 2 days in BC. from the heat wave itself. And those are probably people that are the most marginalized in society already. When we add in the complexity of different issues now interacting, so the pandemic and social isolation, the climate crisis and social isolation, how do you think we navigate these crises in a way that allows us to not experience that burnout that 33% of Canadians are experiencing? How do we stay mentally resilient in times like this?
That's a really critical issue, and I think it's going to be a little bit different for different communities, right? If we think about who is experiencing social isolation, traditionally most research has focused on, let's say, pre-pandemic. Most research has focused on primarily elderly individuals, and the rationale was that there's these precipitating events like loss of a loved one, moving into a senior care center or something like that, that would precipitate and cause loneliness. And so that's where a lot of the research has been historically. But since COVID, and even just prior to COVID, there was a brewing realization that loneliness is actually a much bigger issue than just seniors' health. And so certainly seniors, for example, are really vulnerable to social isolation. But so are teenagers, so are, people in their middle age. And there's actually an emerging body of research showing that it's not even the oldest populations, it's more of like middle-aged that are experiencing the greatest levels of loneliness. And so, that's a really interesting pattern to see, is that it's affecting more people. And like, as you mentioned, when it starts interacting with other issues, that's sometimes we'll describe it as like a syndemic condition. It's when multiple epidemics all kind of come together. And so you can think of like the other populations that have had very little research looking at their experiences of social connection. Imagine being a person who lives on the streets or lives in a park in a tent by yourself, right? The opportunities for social connection are really difficult to build this sort of community because governments and systems are largely resistant to letting you create a camp or some sort of place where you can build community. So you're always being shuffled around. You're moving from site to site to site, never having a place to really call your home. That makes it difficult to form long-term relationships. And yet, largely the research really hasn't explored some of those issues. And so you're right that these like circumstantial vulnerabilities that people experience is really profound. And when you think of what that adds is like in the context, of really 36 degree, 40 degree weather, that has consequences for, is there anybody around to help encourage you to drink some water so you don't get dehydrated or heat stroke, right? If you don't have those people around you to be that sort of support that you would have, if you were in a more privileged circumstance, then that means, you're probably going to see some deaths. And so I imagine, I haven't looked too much into the deaths here in BC, but I imagine that a lot of the people who are experiencing those are people who don't have protection from the elements, or they're elderly and frail. So there's kind of that mix of biological and social conditions that create these sort of epidemic problems that we see, or these syndemic problems that we see. And I think that's one of the big challenges in public health, is to figure out how do we re-gear our system to better respond to those sorts of experiences.
Absolutely. A friend of mine once told me this past year, after he had a freakish accident on his first day in the country, completely new country, different continent, halfway through the semester, and he had a freak accident, but thankfully he was all fine and everything got sorted out. And he was telling me, as we were sitting down and just talking about everything that had happened that day, he said, when I landed here and whatever happened, the fact that I am sane right now is because I had communities and pillars of support around me to keep me sane. And resilience is a privilege, because if I did not have that, then I would have completely broken down. Because there was nobody, if not for the pillars of support around me, to keep me up and running. And that really stuck with me, the fact that resilience is a privilege. We often say that, you need to be strong to get through this time, but that strength is not just inward focused. That strength is also outward focused. It's the people that you are surrounded by, the institutions that are there to support you, and the privilege that you have to have all this around you, both material and otherwise, tangible and intangible, to help you be resilient in times like these. And that's another aspect that feeds into those inequities. A disparity in privilege, a disparity in our pillars of support.
Yeah, I think that's a really interesting way to think about it, about strength, is because, yeah, when you're right, when you normally talk about strength and there's nothing wrong with being strong and seeking and like trying to be your best. Like, yeah, people need self-fulfillment and they need to self-actualize and have those positive experiences so they can feel good about themselves and lead the lives that are ultimately going to make them happy. But when we think of something like strength, right, you can have strength in an individual, or you can also think about strength in terms of a community. So you can intentionally build a strong community, right, in which you invest time and energy to building up those around you. So that when something does happen, you're injured or you're sick or something like that, that you're not just having to carry that by yourself. Because I think a lot of things are, a lot of people's misfortune, I guess, is circumstantial. It just happens to them, right? And no matter how good or strong they are, it's going to have a significant impact on their life. And so I think the way we create communities to serve as a safety net for each other is actually a really beneficial and protective element. There's been some research from economics research and economists doing, different types of experiments and behavioral experiments, and they see that cooperation tends to result in better outcomes for individuals than competition does. But yet our whole society is really geared towards competition. And so our culture is fundamentally leading us to this more dangerous and risky path, even though, I think scientifically we could say that there's pretty good evidence that like you're better off if you build yourself into a strong community and network that will take care of you when you have problems, that will help you get through those hard times, and that ultimately the setbacks that you might experience just by happenstance aren't going to have as much impact. And so I think you're right that that's a really great way to think about strength, is that strength doesn't have to be internal, that, building and spending the time to, be healthy in your community and make your community healthy is actually really to your benefit as well.
I wonder then, if our entire system is geared towards not like sustainability and not cooperation, but that competition and that immediate nature of, I guess, profit in a lot of senses, what we do see in the world. Kiffer, what do we do about that as individuals? And, you make a really good argument that it's actually better for everyone to cooperate, to create systems in a way that are better for everyone. And again, we look at the public health challenges that we see right now. Investing in advance in public health mitigation, in pandemic mitigation would have saved us billions of dollars throughout this pandemic. And so there's also the economic argument for all of this, for action on climate change, for action on social isolation. And it's a net benefit to society to do so now, as opposed to later. Yet we don't see it happening. How do we make that happen? And I understand that's a very big question. Do you have any thoughts on how we make that happen?
Yeah, I'll maybe try to get there. I think one thing that comes to mind is, as you were speaking, is this idea of just the ability to prevent bad things from happening, from having a strong, supportive social community, from cooperating with others and being what we describe as kind of pro-social. And so earlier I mentioned that about a third of Canadians are experiencing burnout. And when we look at the association between burnout and loneliness, we see that loneliness scores, so using a scale, a measure, we see that those scores predict about 40% of the variance in burnout. And so that's a pretty significant impact of that being lonely and isolated has on predicting whether or not you're also burnt out, from work and from life. And so it seems to suggest that the more connected you are might be a protective factor against burnout. And so ultimately that's to your benefit to build that sort of connection so that when you are having a stressful time at life, that you have people to fall back on, people to have those conversations, shoot the breeze with, to lower and lesser stress. so in the context of a pandemic, it's been really difficult to achieve that because not only have we all of a sudden not really connected with our friends and family so much, but we've also no longer, there's no longer those water cooler conversations or those little, on the elevator conversations that used to, be there to lessen the stress. Like those things have been stripped away. And I think we've missed out a lot on the small, meaningful, everyday, tiny little things that you can be doing to help yourself and those around you be happier and healthier. Saying hello to neighbors, having a quick conversation, just talking about how your day was. When we look at the association between those simple acts and happiness and life satisfaction, we see positive effects that the tendency for happy people to do those little sort of things is quite strong. And so I think in some ways we have to both think small while not losing sight of the big picture problems that we're facing. So certainly in a kind of capitalistic driven society, like there are certain demands placed on individuals that make it really hard to live happy and healthy lives. So if you're working 40, 60 hours a week, 2 jobs, and you're still not making enough income to feel safe and secure in the long-term sustainability of your housing and your family, then that's going to have really profound impacts on your health and happiness. And so certainly we need to think about how do we make the reward and incentive structures of our political and social economies work out. So that's like a big politics issue. And that's not necessarily my expertise. I'm not an economist, so I can't speak fully to how we achieve that vision. But I can say that those little daily kindnesses that you can lay out to those around you, taking the time to reach out to friends, is really important. People tend to overestimate the cost of doing those things. So you tend to perceive a social interaction. There's a lot of like memes in our culture about like the satisfaction that comes from canceling plans, right? It's because we're a bit socially anxious and we're perceiving social interactions as being more costly and taxing on ourselves. But it's what we actually know is when people go out and do those social interactions, how many times have you felt after maybe thinking you didn't want to go out with friends afterwards feeling like, oh, I feel great now? Because that fundamental social connection is actually beneficial to you down to the biological level. And so, making people have an accurate understanding about those risks and rewards of social connection is really critical. And so, I don't know what the remedy is for these big political and economic issues and pressures that certainly are driving issues in loneliness. Certainly people are driven to be lonely because they're working too much and they've got too much demands on their time. So they're not emphasizing or valuing those social connections enough. But finding the little ways of what you can do to connect more meaningfully with people, I think that's definitely something that we see in our data from the Canadian Social Connection Survey of being associated with happiness and better health. You see that people are about 40 times more likely to rate their mental health as being poor if they're lonely. And so you also see that people are less satisfied with their life and less happy. And so I think like if we can address that through social connection, maybe it'll give us a bit of the inspiration that we need to connect with others in ways that could address some of those bigger issues, through community organizing and activism, getting people engaged to address and figure out how do we make our workplaces more healthier. People need energy to change the system. And when you're constantly running on fumes, right, it really makes it difficult to put the energy into the sort of activism and social entrepreneurship that is needed to make our world a more pro-human place to live.
Absolutely. That was so beautiful, that entire monologue. I'm just wondering, how do you envision the future to be with this in mind? What can we do at an individual level as people who might not be experiencing this ourselves, but we see people around us experiencing this? Because the one thing that I've seen and experienced myself in this case is that there's a sense of helplessness when you see somebody experiencing this around you, but there's only so much you can do because you feel like you're crossing a boundary, if that makes sense, because it's so inherently personal. an uh, a struggle, if I may put it that way, that anybody's going through. How do you extend that olive branch without being patronizing or condescending or presumptuous? Or is that something that we shouldn't even worry about in the first place? Is that also a cost that we are overestimating?
Yeah, I think probably to some extent. So certainly respecting people's boundaries and having consent and all of that stuff, that is really critical and important. And you need to allow people the space that they need, because you don't necessarily know all that's going on in somebody's life or all that's driving them. And so, but from our data, of finding 4 in 10 Canadians wanting to have more friends, of 60% of Canadians or 50% of Canadians feeling lonely or socially isolated. Like, people want to connect, generally speaking. Like, I think you could say you pick a random person on the street, they're wanting some more social connection than they're getting, especially in the time of pandemic. So generally, you're probably overestimating the imposition that you would be. They and you are probably underestimating the benefit that you'll get out of those social connections should you pursue them. And so I think some of it is a bit about taking the risks and seeing what you can to be more friendly. I think one thing we know about social isolation is it tends to cause kind of a downward spiral, that the more isolated you are, the more costly you perceive and the more negative bias you have about social interactions. Like you perceive your interactions as being more negative if you've been lonely for a long time. And that all kind of creates a feedback cycle in which you're going to be more likely to isolate yourself from others. And so some of it has to be about breaking that cycle of being like, no, we need to teach our bodies, we need to teach the body's stress response system that social interaction is actually good and that you do actually benefit from it. And so I think that does mean taking a little bit of risk and getting people outside their comfort bubbles a little to have those sort of connections. And so I think this is really interesting in the context of a pandemic, is providing an opportunity, but also a word of caution that people have now been isolated in some jurisdictions for as long as 18 months. People are going to be a little bit resistant. I think connecting with others is going to be harder than we think it is to get back to normal. But there is this opportunity for us to recognize that this is important for us to do, that we need to go out there and build these social connections so that we can break the cycle that COVID started, or else we're going to see long-term declines in health. And I think that has serious consequences. There's been some research emerging around the role that loneliness has in creating kind of neoliberal beliefs or more self-interested decision-making. And I think that's a really critical issue too, is because if society now has had, a huge disruption to our social connection, and that makes us think more inwardly, then I think that's going to pose a really big problem for getting some of the big social and structural and systemic changes that we need from our society. And so I think it is really a critical time now to do that. I think the other things that we're facing is that things that we just don't know anything about. The impact that work from home and learning from home is going to have in the long term. I think a lot of companies are toying with the idea of moving more towards a work from home situation, thinking, and I think that's probably what a lot of employees are communicating that they want. Who doesn't want to not have to commute anymore? Who doesn't want to, stay at home all day? I think that has a lot of potential benefits, but there's also a lot of potential risks in those sort of things. So I think to some extent we do have to monitor and look at the post-pandemic period and figure out what exactly about the pandemic is going to be good and can we continue doing, like working from home if it works out, and what potentially exposes us to more social risk, being isolated, not having those water cooler talks and elevator pitches and all those sort of things that are important. And yeah, I mean, a lot of it is a bit of an unknown. So what I envision for the future is, more research to figure out what a lot of this is, what its impact is really going to be. But hopefully we can mobilize people to take action to address their needs in their community and make sure that whatever ill consequence might be coming from COVID and impacting our social connection, that it's not long-term, that it's not long-lasting. Let's get back to normal and then some. Let's be friendlier and kinder to others than we were before the pandemic. And if we can achieve that, then I think we'll go a long ways to achieving some of the other problems we're facing.
It's funny. I was actually talking about this with a friend a a while back where we would just talk about what it would be like in residence. We were sitting in residence and wondering what it would be like for everybody to be back here again, knowing what we know now, but in the conditions that we lived in 2019. And we were just thinking that so many things that we just did before because it didn't seem like there was any other option, we would just stop doing now in the name of efficiency, or because we know that we can get away without doing it. And that is terrifying because, yes, there is an opportunity there, and a lot of things that were broken about the system can be fixed, and we can see that they were broken because they were kept that way, not because they could not be fixed. But there's also aspects of it where it seems like a burden now that we've experienced what it is like without having that. But at the same time, we will discount the pain and the hardships that we've gone through this time just because it seems more convenient outwardly. And I think that speaks to a larger point that as we move forward, it's important to reflect and think about this experience that we're all going through right now, and instead of just defaulting to what we always did, or on the other hand, not taking anything from the past and just going with what we have right now. Both those ends of the spectrum are problematic. What we need to do is retain from the past what we should retain, and then use the time that we have right now as an opportunity to improve on the areas where we've seen we can improve upon.
We have to be intentional about all of it. I think that's really important. And Kiffer, as we wrap up here in this awesome conversation about so many different topics that just blended together so beautifully, like one last question that I do have that I've been curious about for a while is the post-pandemic anxiety a lot of people are experiencing. And we're seeing it in America more than here because we're still mostly locked down, but in the States, and I look at people that are outside in large groups without masks, and I still can't imagine doing that. And I've gotten 2 doses of my vaccine already now. It's not even that I'm scared of talking to the people or the social connections. It's like, I don't really know what it is actually. I think it's like I need more time. How do you think, Kiffer, we navigate that as well, that level of anxiety with being out in the world again, and to Harv's point, being intentional about how we do communicate with others, how we do have meetings, and how we live our lives in a social setting?
Yeah, I think a lot of it is about being a bit brave. I think there's an important lesson that I learned, and kind of, most of my research, like I mentioned, focused on stigmatized behavior. And loneliness is one of those things that if you're lonely, there's a bit of stigma attached to it. It's like, oh, why are you lonely? Are you not a good person to be around? It's like we tend to attach stigma. So a lot of my research in sexuality and substance use and loneliness all kind of focuses on the role that sort of stigma has in shaping some of that. And I think we do see that disease is really stigmatized, right? That we generally view, people who are disabled or with chronic illness or with infectious diseases with some apprehension. And I think it's only natural that in the post-pandemic period that we perceive some of that's held over, right? It's going to be hard to return to normal because some of the perceptions of like, am I at risk and that sort of thing. And I think everybody's going to have different levels of tolerance. People have different levels of tolerance for risk for lots of different activities. You might feel comfortable skydiving, whereas another person doesn't even want to leave 3 feet off the ground, right? Like they're afraid to jump. Because people have different comfort levels, and I think we have to respect that and really have the conversations about, what feels safe to you. And so I think like that's something that everyone can do now as they're looking forward to building more close connections with the people they love and with their friends and family, is open up conversations, be like, hey, what are you comfortable with? And I think having that sort of respectful conversation that gives people the opportunity to say, yeah, I'm comfortable hanging out in your house, or, I'd rather hang out outside, and should we use masks, yes or no? And figuring out some of those key pieces is going to be something critical that we address in the pandemic period. I think you're right that there are going to be some awkward and hesitant moments and experiences, but you just have to be brave. You have to be like, I'm willing to take the risks because I believe, and the science says, that the rewards of social connection will be greater than the potential consequences. Of course, listen to your public health officials. There are variants, and there is lots of reasons to, even if you're fully vaccinated, to raise alarms and concerns. And I think, the science on the COVID virus is still kind of evolving, and we're still learning about it. And so it is just going to take some time to figure out some of that sort of stuff. So always listen to your public health, but also make sure that you're respecting those around you, but that everyone can agree that we're going to be brave. We're going to take healthy risks for the betterment of our communities and our friendship groups and our families.
Yeah, it really is a matter of balancing those risks and understanding. And I do love the disclaimer about the variants and wearing masks. I think it's so important. But Kiffer, this has been such a lovely conversation. I think everything that we've talked about, from social connection and isolation pre-pandemic, social media and how we tend to demonize it, but there is a lot of good there, and it's about the use of social media, about how we engage with other people and what loneliness really is, and even the stigmas associated with loneliness, disease, and so many different topics. And I think at the end here, this discussion about the crises that we face in society beyond the pandemic, the climate crisis, looking at public health at large, and how we reimagine systems and how we play into those ourselves to be better people, to reach out to others, to make people feel safe and be resilient ourselves. This has been such a wonderful conversation.
Yeah, thank you both for having me. It has been lovely, and to hear what your perspectives are has been great. And so, I look forward to all that you do in future episodes, and I think it's a really great movement that we're working on to try to help people be more kind and empathetic and connected.
Thank you so much for that. That means a lot. We really appreciate it. Well, folks, that was another episode of Different Boat, Same Storm. We'll be back again next week. Different guest, same time, different boat, same storm.